Aș vrea să introduc acum următorul vorbitor, profesorul Ethan Bergman. Dânsul este președintele Academiei de Nutriție și Dietetică. Ei și-au schimbat numele anul trecut, până atunci au fost Asociația Dietetică Americană. Este asociația cu cei mai mulți membri, la ora actuală peste 72.000 de membri. Sunt și eu unul din membrii acestei asociații. Ceea ce vreau să spun despre dânsul, dincolo de faptul că este profesor, este dascăl, dânsul a combinat și în practică nutriția cu dieta. Ați văzut că toate ghidurile au și au parte de nutriție, bineînțeles, ghidurile nutriționale, dar undeva într-un colț este și ceva în legătură cu exercițiu fizic. Dânsul este un sportiv, a alergat în multe maratoane, am înțeles și într-un triatlon și cred că și azi de dimineață și-a pus Adidas și a alergat. Îi spun bun venit!
Thank you, Dr. Dan, and I'd like to add my thanks to, we had several people helping us when we came into Bucharest. Dr. Dan's brother Christian and Mihai and Michael helped us all over, chauffeuring us all over the countryside and showing us your beautiful countryside. So we're very happy to have had that opportunity, and we thank them for providing that service to us and the friendships that we're making. Today, I'm going to be talking to you a little bit about the Academy of Nutrition and Dietetics. And like Dr. Dan said, it's the world's largest organization of food and nutrition professionals. We have almost 74,000 members, which is really startling. I'll talk a little bit about that, how that came about. But it didn't happen overnight. We started in 1917. It's a pleasure for me to be here today with some of my colleagues from the Academy. We are all going to be speaking over the next 3 days, and they'll be introduced, but I'd like to thank them for coming as well and for the hospitality you've shown in inviting us. So thank you all for doing that. I'd like to speak a little bit now about the Academy. The Academy has several different purposes, but mainly, like Ann mentioned, is to make sure that the people that we train are competent and that we maintain that competence over the lifespan of their practice. So we are dedicated to doing that at the Academy to provide those opportunities. We also, like Ann mentioned, are dealing with public policy and trying to make sure that we have things in place in our public policy, in our government, and in our legislature, that we have dietitians written into laws that provide service. So we're very much into promoting public policy and dietitians across the nation and all the different places where they practice. As Dr. Dan mentioned, we did change our name this year in January. We were the American Dietetic Association since 1917, 95 years ago. 38 dietitians got together in Cleveland, Ohio, and they decided that they needed an association. And one of the major thrusts at that point in time was to try to make sure that the American people were dealing with food conservatively during World War I, the First World War. And they have, since then, we have evolved so that our mission and vision has changed to change with what's going on in society. So we, over the last 95 years, have gone through several changes and evolutions or continued evolution to meet the needs of the people in the United States, because our number one goal is to try to improve the health of the nation. Our name may have changed, but our commitment to maintaining that health of the people in the United States and across the world is something that will never change, and something that is very much in the roots of our organization. With our name change, we had to market that, because we were the American Dietetic Association for 95 years. and people knew that organization. But we felt it was time to change the name because we thought that we needed to include nutrition in the name. We thought Academy provided the idea of science-based practice, evidence-based practice. And we also wanted to get out of the idea of there's about 15 ADAs in the United States. So we, American Diabetes Association, American Dental Association, American Dance Association, all kinds of ADAs. So we wanted to also get out of that ADA loop. And we thought that Academy, adding that to our name and also adding nutrition to our name, would provide not only capturing the word nutrition and what that means to the public, but also that the Academy gives that science-based feel to the public and to the type of practice that we are doing. To get that name out, we did lots of marketing, and this is just 2 examples of where that happened. In the Los Angeles Times, a major newspaper in the United States, was just one place where they picked up the story and talked about the change and why that happened. But also the Times Square, I think this is a pointer, see if I can, this is a notice in Times Square in New York City, which is one of the busiest intersections in the world. The estimation is that 1 million people go through that intersection on a day. And that was also something that we put early in January when we changed our name, so people saw that. We at the Academy have a strategic planning, ongoing strategic planning process that every summer and coming in the end of July and early August, our board of directors will meet and we'll look at our current strategic plan and we'll see if we need to change it, make modifications to it. Part of that strategic plan is our mission and our vision. Our vision is what we aspire to, what we want to have happen. And again, our number 1 focus is optimizing the nation's health through food and nutrition. So that's what we really are focusing on. But then our mission is, why do we exist? Why are we an organization that promotes registered dietitians? It's because we want to empower our members in all the different ways, all the different organizational units that we have, to make sure that our dietitians are the food and nutrition leaders in the United States. So that's our reason for being. And we'll talk about over the next several minutes how we are trying to do that, how we're trying to position ourselves so that we as an association or as an academy are promoting dietitians and trying to provide them with the training, initial training and secondary training and continuing education that will allow them to maintain that status in the public's eye and in their practice areas. Now, one of the things that we use as a benchmark to see if we're doing that is our membership. If we're providing good service to our members, providing information that is going to help them to be out in the forefront in the public, we think membership is a way to measure, or a measuring stick that will allow us to determine if we're really meeting the members' needs. And fortunately, we think we are doing that in that we have had increasing membership over the last 7 years. Right now, we're almost at 74,000 members as of the end of April. That's 3% higher than the year before, and it's the highest we've ever had, highest membership. About 3/4 of those are registered dietitians, about 50,000 of them. One thing you might want to notice on this slide is this international category. And Dr. Dan mentioned you're an international member, is that correct? I think that's right. Yes, I think you are. But that membership is also increasing. We're up to 518 international members. And international members are individuals who are from another country who have the qualifications to be a registered dietitian in that other country, or some sort of nutrition training that puts them in the forefront of nutrition, and they have the regulatory body providing information that they are a registered dietitian or a dietitian in that country. If you're interested in international membership, I'm going to ask my colleagues from the United States to raise their hand, Karen and Jesse, and then Bert and Gigi. are all people that could probably give you some information if you're interested afterwards to talk to us, and we can give you information about international membership. But that, again, that's something that we're promoting, and we think it provides an opportunity for members in other countries to have some of the information available that we have on our website and other places. People who are international members can be members of some of our committees that we have, and also they can attend all of our meetings. To stay competitive on the marketplace and in the public's eye is really a challenge, because, as you all know, nutrition, dietetics, health is changing day by day. We get new information out, new research is out there. Trying to maintain that situation where our dietitians are competitive is something that's a challenge. And as an academy, we feel that one of our major goals is to provide opportunities for our dietitians to be out there, to learn information through professional development and through the marketplace that we offer different opportunities for our members to, for their initial knowledge base, and then also for continuing knowledge base, to provide opportunities in that area. So we have professional development and continuing education as a priority in our academy. And like Ann mentioned, it's very important to maintain that so that we have people that are practicing and providing good service to their clients, and then those clients are improving their health. So we have information available that I'll talk about here in the next few moments. The number one place where we provide this service or this knowledge base is in our annual meeting, and we call this FNCE, and this FNCE stands for Food and Nutrition Conference and Expo. And this is offered yearly in October. This year it's October 6th through the 9th in Philadelphia on the East Coast of the United States. You're all welcome to attend. We'd like to have all of you be there if possible, or some of you anyway. It's a conference that has up to 20 hours of continuing professional education over that period of time. Registered dietitians are required to have 75 continuing education credits over a 5-year period after they've done what's called a professional development portfolio to determine where they need to have continuing education. And our meeting provides up to 20 of those continuing education hours. Most dietitians who attend this, we'll probably have 10 to 12,000 people attend this meeting in Philadelphia. And the reason they come is to get these continuing education credits. But one of the other things, I'm a university professor, and I run into a lot of my former students there, and it's a wonderful networking opportunity to network with people that you know and continue friendships. So there's lots of different reasons to attend, but largely it's to get those continuing ed credits. We have some different formatting that we were trying. We have some point counterpoint kind of debate type things on certain things like nutritive versus non-nutritive sweeteners, and whether antibiotics, using those in animals is going to have any impact on humans. So we've adopted some different methods that we think are really usable and very much appreciated by our members. If you want to find out more information, and I have the website right here. Our website, the Academy of Nutrition Dietetics website, is www.eatright.org, and the FNCE information is at /FNCE. So this is our major website, and then that gives you information about the meeting. So if you're interested, please take advantage of that. As you all know, we are changing in a changing environment. We're in a very dynamic situation in every country in the world, where we have different problems now than we had 10 years ago or even 5 years ago. So to try to capture that and to try to kind of reformulate our focus on the future, we had a conference called a Future Connections Summit in 2011, where we had over 2,000 participants at 7 different locations around the United States. And what we did is do a future search where we did a design thinking type strategic planning method of inquiry to determine where are we now and what does the public need and where do we need to provide education to meet that public need. And so this 3-day conference or 3-day summit, which was partially person-to-person, partially virtual, determined some things that we're going to be working on over the next several years. We have a council on future practice, which is taking kind of the lead role in this. It's a council of about 7 individuals who've been selected from different areas of practice, and they're been given the results from our Future Connections Summit, and they're looking at what we need to do to change things such as the education of our initial education of our individuals who are receiving their the registered dietitian credential, what continuing education people need, what do we need to do differently with credentialing. Right now we have 2 credentials. We have a dietetic technician registered credential and a registered dietitian credential. Do we need to have more credentials? Do we need to have more training for advanced practice? So all those things are being looked at. We expect the Council on Future Practice to give us more details at our meeting in October in 2012 at FANCY, our Food Nutrition Conference and Exhibition. We have had a presence on radio in the Chicagoland area. Chicago is the 3rd largest market in the United States as far as number of people and number of listeners. And we've had information three times a day, Eat Right Minute, presented at since 1995 on this radio station in Chicago. And if you want to look at or listen to some of these, they're at this site. You can go there and they have the current one. You can listen to whatever today's was, and also they have a backlog of some of the, well, thank you. I'm up here sweating I need some water. That's good. That's just like running this morning. I did a tour of the campus. I did about 5 laps around. It's really a beautiful campus, by the way. I really enjoyed it. People didn't throw stuff at me or anything, so I was very happy about that. And I ran in Bucharest, and I had 3 dogs chase me, and I ran a little bit faster when that happened. I didn't have that happen here, but maybe if I would have had some dogs, I would have ran a little faster. But this is just like a little workout up here, I guess, today. But we have the radio we have the backlog or the history of lots of different since 1995 on that site. But we're also expanding this. We're also going to the point where we now are making this available to any radio station across the country, and we're starting to market that, and we're calling it Eat Right Radio. And so there are 60-second and 30-second PSAs, public service announcements, that radio stations across the country can pick up, and they can utilize that. And dietitians in those different markets can talk to their radio stations and brand themselves and make that available. Oh, we have all kinds of helpers. Thank you. So it provides an opportunity for people who are not only in Chicago, but in all areas across the United States. These are put together for target audiences. We have a large Spanish-speaking population in the United States. Some of them are written in Spanish or presented in Spanish. We also have scripts that people can use in their local market. We have things related to men's health. We have things that are related to different components like urban markets or Asian Americans. So there are all kinds of different options to choose from. And we're really excited about this because we think it'll allow the brand of the Academy to move across not only from local communities, but also so people can recognize who a registered dietitian is and promote the Academy, which are win-win situations for individuals and for people who are receiving that information, because they're getting good information that's science-based, and it's a really win-win situation. One of the things that we've done also over the years, 20 years of consumer insights over 8 different nationwide surveys. We've done nutrition trend surveys, and the latest one was presented in 2011. And from these surveys, we get an idea about where people get their information, what kind of information they're seeking, what's important to them, and then we can use that information when we do our programming. We know what sorts of things people want, where they're getting it, and then we can provide that information. We know that from this trend survey that people are getting a lot of information from the internet, and they're getting information from places like Facebook pages. So when we changed our name in January, we also had the opportunity to change our Facebook. We had one page, now we have 2 pages. One is a page that's really dedicated to members, providing information to members about continuing education opportunities, those sorts of things. But also, we took the opportunity to make a public Facebook page. And so this public Facebook page provides information to the public that it really focuses the public to seek information from registered dietitians, but it provides good science-based information, that tips of the day that would be helpful for a person on a daily basis. So we have these 2 Facebook pages now that are very important in our marketing efforts, not only to our members, but also to the public. We have a month that we set aside as National Nutrition Month every year, and we've done this for 20 plus years. March is National Nutrition Month, and this year we chose as a theme, Get Your Plate in Shape. And Get Your Plate in Shape has a couple different things. First of all, we know from our trend survey, people want to improve their conditioning or their shape, improve their body weight and those sorts of things. But we also know from our, we have United States Department of Agriculture has recently changed the icon that they use to promote the dietary guidelines for Americans to My Plate. And this My Plate is basically a plate that has food on it, and half of that plate is filled with fruits and vegetables. So this National Nutrition Month was also promoting that My Plate, that people would hear from nutrition experts about what is a good way to, a simple way to look at your plate and see whether or not you're really doing something that will promote health. And by having lots of fruits and vegetables on your plate, you're going to not have as many things that are high fat, high calorie content, but high fruits and vegetable content will give you the minerals and the vitamins and minerals and the nutrient density that we all will benefit from. We also had, for the 5th year in a row, a Registered Dietitian Day nationally, and in it was March 14th this year. It was Registered Dietitian Day that people could celebrate across the United States, and dietitians could take advantage of that. We have public service announcements in both English and Spanish that are available. This is just a couple of individuals. We have a series of people that are nutrition and dietetics spokespeople. We call them a spokespeople program, and they're trained and they're in different markets across the United States and some of the larger markets like Los Angeles, New York, Chicago, but also they're in certain practice areas so that they have expertise. And so these 2 individuals are just 2 of our spokespeople who have done public service announcements that can be marketed to different radio stations and for use on video as well. You can look at these, by the way, the ones that we have available on our YouTube Academy Media Network. So www.youtube.com/Academy Media, and you can see all the different public service announcements that are available for people to use. One of the other ways that we're promoting, and from our nutrition trend survey realized that people are seeking information from the internet, we're utilizing a joint consortium with a website called ShareCare, where Eat Right members can provide information to clients. And the way this works is our members, our spokespeople are part of this, but any member of the Academy of Nutrition Dietetics can become a share care partner. And then as a consumer writes in a question, that consumer can ask a question, and if it has to do with nutrition, then that person can get their answer from a registered dietitian. And so the question comes in from the consumer. The person that is receiving that question will triage it at ShareCare, and they'll direct it towards a registered dietitian if it's a nutrition-related question. These are, they could be about cancer, they could be about diabetes, and then those individuals receive good information from a reputable source. And these are, again, win-win situations where the client who's asking the question gets a good answer to their question, something that's science-based, that has good documentation. And second, it's also promoting the registered dietitian in the academy, because those people who answer the questions then are noted, their titles and who they are, so they're good branding of that individual and their place as members of the Academy of Nutrition Dietetics. Another real important aspect of our function is to provide information about home food safety. And the Academy has coupled with and partnered with a private food organization called ConAgra, which you may be familiar with. And they have this partnership to promote a food safety program that is available. And it's, again, available on this website, homefoodsafety.org, and it has, again, an opportunity for people to write in questions about food safety, how long things can be safe at certain temperatures, all sorts of answers to certain questions. So this is a good combination of individuals from our academy with people at ConAgra, with funding from ConAgra to provide this opportunity to help people maintain a safe food supply. We have a books and resources team that produces between 6 and 9 new publications a year, and that updates lots of other ones. We have print and web versions. As you all realize, we have more web now than we had in the past, and less print. But we know that there's still a need for print publication, so we are constantly trying to find that good balance between print and web resources. But we have lots of different web resources that individuals can buy, organizations can buy, like hospitals, that are used in lots of different places. Some of these are the Nutrition Care Manual, Pediatric Nutrition Care Manual, Sports Nutrition Care Manual, Professional Skills Review, lots of different things available for people who are trying to maintain their skills. We do have some apps too. There's an app for everything, and heard that several times in the last couple of days. But a couple of apps that we have, and they may be finished by now. One is called the Gluten Detective. Another one is called Nutrition for Your Sport. We also have one that's called Nutrition Guides, and it's our evidence analysis library. NutriGuides is an access point from your iPhone that you can use to access our evidence analysis library. And I think it's $2.99 or something like that, which is, what's the equivalent? What would that be in RON? 3.5? 10 RON, something like that. So it's a pretty cheap access point on your iPhones. And I think it's also available for other smartphones. So those are available for you as well. One of the things we also have taken advantage of with our change in name, and just to try to promote nutrition dietetics and the registered dietitian, is we now have a new magazine called Food and Nutrition. And this is a very important access point for individuals, not only for our members but also for the public, because it provides lots of information. I've got enough up here, I think. I'm just utilizing the same one over again. Thanks. But there's a parallel website, which is, again, shown here, foodnutritionmagazine.org. One of the really exciting things about this is, from my perspective, is we start seeing heroes that are presented, registered dietitians that are doing great things. And we have a section in our in our Food and Nutrition magazine that shows some of these great things that registered dietitians are doing out there in their practice areas, how they're improving the health of the nation and individuals and the world, for that matter, in their different practice areas. And I love to read these because it just really solidifies my faith in nutrition and dietetics and registered dietitians, that we are doing great things out there, and we have lots of different examples of that in this publication. So take a look at it if you get a chance. Again, foodandnutritionmagazine.org. We have a foundation, and this foundation is largely invested in providing funding for different things, for largely two different areas. One is for scholarships for students, and the other is for providing funding to try to tackle the most serious health problems that our public faces. One of the places where we are really putting a lot of our funding is in a program called Kids Eat Right Initiative, and this is largely towards trying to improve the obesity incidence and rates amongst our young people, and also improve obesity rates and try to prevent obesity and trying to find ways to do that. And our Kids Eat Right program is all about trying to prevent and then solve that problem. We also have a large funding source for our students. And this last year we had almost $450,000 in funding to about 211 students nationwide. We also have different opportunities for recognition for leadership awards, honorariums, for people who are excellent in our field in different areas of nutrition and dietetics. We have awards that we give out, and to recognize leadership in nutrition and dietetics. This is Sylvia Escott Stump on the right, and First Lady Michelle Obama on the left, President Obama's wife. The United States Department of Agriculture just put out new regulations for our school meals programs. And Sylvia, our previous president, was able to be at that when those changes were announced in Virginia in January. And we were very much behind these changes. Lots of our members were involved in the changes, promoting, trying to have good school lunches and school breakfasts that are available, having regulations that really try to make those a very important aspect of the nutritional intake that our kids have on a daily basis. We have many of our members are in school lunch settings, and they're the ones that are making the menus for our lunches that are served in schools and our breakfasts that are served in schools, and they're already making these healthy changes and providing the opportunity for children to get good nutrition in their school setting. So we're just about at the end of my presentation. I have one more thing I'd like to do before I close today, and that's to provide some information, or a plaque to you as a new organization. And I'd like to have your president come up, and also Dr. Dan, and I'd like to make a presentation to you at this point. So if you'd come up, that would be great, and we'll provide you with some information that we would like to, come on up. First of all, like I said previously, we're very proud to be part of this first meeting of the Romanian Association of Nutrition and Dietetics. We know that this is going to make a huge difference in the health of the population of Romania, and we're just really pleased and honored to be part of the initial meeting. So I'd like to present this plaque, and I think we may have a picture of the plaque up here too. you won't be able to read it, but I can read it to you. And this plaque says, in recognition of the first conference of the Romanian Nutrition and Dietetic Association, June 25 through 29, at Targu, Mures, I probably slaughtered that name, sorry, Romania, presented by the Academy of Nutrition and Dietetics, Ethan Bergman, president. So I'd like to give this to you at this point. And congratulations. And this will be, like I mentioned, having this association in Romania will have huge impacts on generations of Romanians health-wise and their nutritional status. So thank you very much for doing this. I wanted to also provide a few things. I know we are going more to virtual things, but we have a few of our publications I'd like to give to you, some pocket guides that you can use, and they're available for you to use as you would, and thank you for providing this opportunity for us, and we appreciate being here. Thank you. So I think that's the end of the presentation. We'll have time for questions later. Yeah, thank you. Thank you, Paul.
Thank you very much. This was really a... Yes.
Got to turn it off.
By tomorrow everything will be better. Pentru că avem timp pentru întrebări, până vă gândiți, aș vrea să adresăm o primă întrebare ambilor vorbitori. We want to start the question and answer session with one question. Ați observat că recent Asociația Dietetică Americană și-a schimbat numele? Recently, the American Dietetic Association changed their name into Academy of Nutrition and Dietetics. But on the other hand, we see that it's important to stick to the name Dietician. This gives the distinction to our profession. So my question is, where do we draw the line? And why is it so important not to be called nutritionist? Why is it important to be called dietitian? Why is it important on your diploma to be written dietitian? So this is the question.
That's a question that we have been asking the Academy has been asking, or the Association of Nutrition Dietetics has been asking for many years. Do we no longer call ourselves dietitians? Do we call ourselves nutritionists? Do we call ourselves dietitian nutritionists? And one of the thoughts we're having right now is we want to maintain dietetics as it's part of our credential, it's part of our history. It has kind of a unique definition. But we were thinking about changing our credential, and this is something that we're considering part of the Council on Future Practice, that we may call the credential Registered Dietitian / Nutritionist. One of the reasons we're considering that is because our public knows what nutrition is, and it's been a kind of a struggle to help the public realize what a dietitian is. They know if we have nutrition and dietetics together, I think it kind of helps solve that problem. So that's kind of the initial answer that we have.
That's an interesting view. We want also to see what's the situation in Europe.
Thank you. That's interesting, because in Europe we are going to start a debate about this.
that better? We're going to start a debate. The reason we are starting a debate is because in some countries you can call yourself a nutritionist if you have had 3 days of instruction. And there are courses you can go for a weekend and you get a certificate in nutrition and you can call yourself a nutritionist. The nutritionist then advertises, they know all about nutrition, come to us. And the problem is they're unregulated, they may give unsafe advice, and this is a real problem for dietitians, I think. But it goes further than that, because within Europe there are nutritionists that are employed, and I'm thinking particularly of Spain and Portugal. And they are employed as nutritionists, but they do the work of a dietitian. They actually say they do the work of a dietitian. And we in EFAD have no reason to question that, because we've looked and they probably do. I understand that in Argentina they've now changed. They're no longer dietitians in Argentina. They all are nutritionists. In Britain, in the UK, the nutritionists, these are people who have a 3-year degree in nutrition, are now forming a professional association. And this professional association has competence statements, it has a code of conduct, it has a registration system, and you can look on the website and you can see who are registered nutritionists. But they do not do what dietitians do. They don't. They don't have the education to do what dietitians do, and they would not think of themselves as dietitians. Nevertheless, they are professional nutritionists. So we have a real issue here in Europe. We want to protect the public. We want to tell the public, be careful when you go. If the nutritionist has a professional qualification, that's different. But how does the public distinguish between who can give the advice about dietetics and who cannot? So I'm interested to hear what you say, but it's going to be difficult. I think it's taken us a long time to get dietetics recognized. I think the public are just beginning to understand what a dietitian is, and if we change the name, they will go back to utter confusion. Be careful.
This shows us that we need to learn from each other, but also we need to be sensitive to what's happening in each of our countries. There are questions for Professor Deloy or Professor Bergman. Any question? Oh, here. Between registered dietitian here and in... The question was if there are any difference between the registered dietitian in Europe versus United States.
Okay, I make a... Yes. I will make a start, and then you can tell me if I have it right or wrong. Within Europe, there are 3 categories of dietitian. There's the clinical dietitian, the public health dietitian, and the administrative dietitian. This is the food service dietitian. And in some countries, they only educate clinical dietitians. In other countries, they primarily, the majority, are administrative dietitians, food service dietitians. And so that is the biggest difference, because as I understand it, the dietitian in the States has all three, but particularly the food service management side. So if I am a clinical dietitian and I compare myself to the education in the States, I lack food service management. And I would say that would be the biggest difference between the two. But if I am trained in somewhere like Sweden or in Denmark, I would have much food service management as well as some clinical. And that would be more acceptable, I think, to America. But maybe I've got it wrong.
When we train our registered dietitians in the United States, they all get all those different areas: clinical, food service, public health, and then they can practice in any of those areas. A lot of the specialty happens with us after the initial credentialing, so that we have 75 continuing ed hours required every 5 years after the initial credential is established, so that if a person graduates and they choose to be in a clinical setting, then they're going to concentrate their 75 hours of those next 5 years in those areas that they're going to be practicing in. And that's what we have, what's called a professional development plan that they put together, and they examine their own practice areas and determine where they need additional work, and then they seek those sorts of additional hours of professional education after their initial credential. But that person could go back and become, after they're a clinical dietitian in a hospital for 20 years, they could go back and become a registered dietitian in a public health setting. Now we have, that's part of our mission, is to have this professional education available for those people, so they can actually go in and look at where they have gaps in their education, and then they can seek information if they're making that sort of a jump from one area of dietetics to another, and they can do a assessment of their own background, what they currently know, even take quizzes on areas to determine if they have enough information in that area to practice, or if they need to do more professional education in that area to practice in that area where they're now going to choose from another, or jump from one area to another. But the initial education that all of our dietitians get allows them to enter as an entry-level dietitian in all those areas that Anne mentioned. You want to add to that, Jesse?
Hi, Jesse Pavlinek. As far as the U.S. is concerned here, I think I'm the only specialist in an area of practice. So I'm a certified, board-certified specialist in renal nutrition. So after practice of 3 years and a certain number of professional hours in an area of specialty, where we then sit for an exam that we have to take every 5 years. And so I have been a certified specialist in renal nutrition for 20, ever since we've had them, 20 plus years. I currently am on the specialty panel for the Academy and write for that renal specialty exam. And so that's another way we get more specialized in clinical. We also have them in sports nutrition, in diabetes, not in diabetes because we partner with somebody else, oncology, sports nutrition, geriatrics, so for the elderly, and we're looking at perhaps a specialty in management. And then I think our next step is to see, we're working towards looking at advanced level practice and how to differentiate that from specialty and general practice, how to make sure that those competencies are achieved in that tough, very tough area. I don't know that we're going to do like nurse practitioner model, but something to see advanced level. So in renal nutrition, for example, there are some, anybody work in a dialysis unit? Are they? Okay. So in this country, maybe not, but in the United States, by law, we have to have a dietitian in every kidney dialysis center. And some of those dietitians are actually managing the bone mineral management like phosphorus and calcium, and some are managing anemia. And so those are doing kind of an advanced level even more than maybe a specialist would do. So it's just another model.
Thank you. And I think what we're hearing here is wonderful. And my question to them would be, you have been in operation for 95 years. And if I think around Europe, and I think about the employment of dietitians in hospitals, it's really important even to get a dietitian into a hospital. If I think of Malta, Malta has one of the highest rates of diabetes, and it has one dietitian in the whole island. That is the status. It's very, very variable in Europe. And that's where they were 50 or 40 years ago. So I think we're starting with baby steps. You have a huge group of people to call upon, both in the States, in Canada, and perhaps a little bit nearer, who are going through some of the very same issues that you'll be going through in Europe, because we are not anywhere quite as advanced yet as you're painting. But what a wonderful thing to really hope that we can do. And we will get there. I know you will get there.
And I think part of the, yes. And I think, I'm thinking back to Anne, and we spent some time in Portugal, and I met a woman who was one dietitian for a hospital that was 460 beds, which is a huge challenge. I'm in a hospital of about 528, and we have 27 dietitians, which is not as many as some others, but interestingly enough. But I think meetings like this is how we learn how to do it a little more quickly, and to also learn from how maybe not to do it. And in the United States, we're a bit unique. May I continue, Sir President? Sorry. We're a bit unique in that we don't have a government per se that is making those regulations that either hinder or help a lot in determining how the practice and profession of dietetics is going to be. We have some, and we fought greatly to get some recognition, particularly for payment of services. So we struggle because our healthcare system is more of a fee-for-service kind of system, rather than everybody gets it. We're trying to get there. But we don't have, and we've got 50 states and 50 different ways of doing things. The commonality that we have is that we do speak the same language, although if you go to different parts of America, the dialect is so much different you would not recognize it as the same language. But we do have that. But we have 50 state governments within a federal system that has not recognized dietitians until the last 12 years as being providers of any kind of reimbursable services. Whereas you guys are working very hard to make that around Europe, which I think will help newly established associations and countries, because it will be easier from that perspective, perhaps.
And of course, like much of the world, we are struggling economically, and we understand that some healthcare providers cannot employ dietitians. So at one stroke, all the renal dietitians in a large Lisbon hospital were sent away. So it really is something that we have to work on. We have to do our homework. We have to understand the politics. I'm sorry, but we really do. And we have to do our research to show we make a difference. And if you show you make a difference and you can save people money, they will want you there. So we need to really think very much about our education, but we also need to think about how we work in that environment. And I know your association is going to help you to do that. So it's a big job, but we can do it. What does Obama say? Yes, we can. Isn't that what he said? That's what he said. So yes, we can. Where's Florina? Yes, we can.